Have you ever felt that one of your arms was dead? Maybe you woke up in an awkward position and realized that you couldn't move your arm. It was like practically dead. And do you also remember that initial fear that grips you, like, yeah, what the heck is going on? And then eventually when you start to feel that blood rushing back into the arm, some power starts to get into the limb and you get some relief, some heave a sigh of relief. Do you remember what that feels like? Now, can you imagine if that initial weakness, that loss of power, can you imagine if that was permanent? Today we're going to be talking about how obesity causes strokes. But as usual, before we go on, kindly like, subscribe, hit the notification bell so that every time I post a new video, you will be aware. Let's dive right in, shall we? So when you hear the word stroke, what comes to mind? Some people may be thinking about how they pet their cats by stroking its fur. Some people may be thinking about heat stroke. Some people may be thinking about the strokes that go on in the bedroom. Some people may be thinking about whatsoever, but that is not what I'm talking about. When I hear the word stroke, I see someone who is bedbound, who can't talk, who can't move one side of his body, someone who is drooling, someone who can't use the washroom himself and needs his diapers changed, someone who has to be carried from one point to the other, someone who can't take care of himself. That is the image I see when I hear the word stroke. So, what is a stroke? A stroke is basically a deprivation of blood from getting to certain parts of the brain, and this can happen either from a bleed in the brain or a clot or something occluding a blood vessel in the brain. All this can prevent blood from reaching certain parts of the brain, and once blood is unable to get to a particular part of the brain, a stroke has happened. Depending on the part of the brain that's affected, you would see different signs and symptoms. Someone may be unable to talk when he has a stroke. Someone will be able to talk. Someone may be unable to walk. Someone will be able to walk. Someone may be unable to swallow. Someone will be able to swallow. It depends on the part of the brain that's affected. Now, there are so many things that can cause a stroke, hypertension being one of them, and we have discussed hypertension in our last video. Today we're going to be talking about how obesity can cause a stroke. First and foremost, obesity can cause you to get a stroke by predisposing you to hypertension, and once you get hypertension can also then predispose you to getting a stroke. So there's that cascade. Apart from that, obesity leads to clogging of our blood vessels with certain cholesterol deposits, and once those happen, you are predisposed to developing clots within your blood vessels. These clots can dislodge and travel into the brain and then cause a stroke. Sometimes the clots don't even have to dislodge, they just grow and then block the blood vessel, and then you develop a stroke. Okay, obesity is also one of the major risk factors for diabetes. I have hammered on this point over and over again. I'm sure you're tired of hearing it, but it is something you need to know. Diabetes, hypertension, obesity move hand in hand. They come together to form a syndrome, and this collection is like the Planeteers coming together to form Captain Planet. It's with the powers combined. It's like the Power Rangers coming together to form the huge robotic machine. I mean, powers combined come together to form so many terrible diseases. Okay, so stroke being one of them, hypertension being one of them, diabetes being one of them, and all these are linked. Research has shown that obese young adult men were 73% more likely to get a stroke than young men who had a healthy BMI, and obese women were 46% more likely to develop a stroke than women with normal BMI. So do we see the correlation between obesity and stroke? So if you never had a reason to lose weight, you never had a reason to try to maintain your weight, remember the image of someone lying bedbound, drooling, can't walk, can't talk, sitting or lying in his own poop, having someone to change his diapers for him, basically not living but existing. If you've never had a reason to lose weight, remember this image. And if you want to lose weight the right and healthy way, I have developed my very favorite top 20 research proven tips on how to lose weight the right and the healthy way. Kindly click on the link in the description below and get access to this free resource. All right, thank you very much for staying to the end of this video. I hope you have been enlightened a little, and I hope that you continue to stay healthy. Catch you in the next video. Bye for now.